Hi everyone, my name is Steven Vargas with Gonzaba Medical Group. I wanted to first thank you everyone for joining us today on another fantastic Connection Wednesday. So at this time we have Dr. Melissa Martinez Diaz. She is our main location on Pleasanton Road. She is going to be discussing with you mental health. A lot of good things to let the seniors know, Dr. Diaz, correct?
Yes, especially this month is a mental health awareness month. And what is mental health? Basically, it's a state of well-being in which the individual realizes his or her capabilities and dealing with the stressors in life. Right now is dealing with the COVID situation, and this is going to help us to manage this a little bit better. What influence mental health is our social and economic factor, stressors in life. It depends on the behavior or genetically predisposed how we are to the things in life what our parents had in the past. And mental illness is actually a manifestation of a disease related to these conditions, such as anxiety, schizophrenia, depression, substance abuse, and we need to recognize those signs or symptoms in the population.
Yes, and those are good points, and that's all good to know. I mean, especially for our seniors right now that they are dealing with a lot of situations in regards to the COVID-19, having to stay home. They don't get to go to their activities like they normally do. So that is fantastic information. Is there anything else you'd like to add?
I would like to recognize to everybody, how do we know a person is at risk or a family member is at risk or our children are at risk? Mental illness affects everyone. It doesn't discriminate against sex, age, or status economical, or even education. We healthcare workers, friends, first responder also are at risk. So the sign and symptom is withdrawn. Patient gonna withdraw. They're not gonna enjoy activities. They're gonna be probably not able to enjoy the regular. Especially now that has to be in quarantine, we have a sense of loss. And we also have cut our communication with the exterior world, it's artificially done like that. And you need to recognize if the patient is paying the bills, if patient is eating, if patient is sleeping well, the family member is coping well with this situation. So there's alert sign that we need to know. Excessive sleepiness is a problem. Eating too much, we all guilty of that one. Or eating too little is also a sign of a mental illness. Excessive anxiety, not able to cope well with any news, or people are too nervous about anything. When it's excessive, anything excessive is a problem.
Wow. That's a lot of great information, Dr. Martinez, and we really appreciate you. So I'm sure you have a couple of patients that you help with in this, and anyone that joins Gonzaba Medical Group and they're wanting to come with you and they do suffer from mental health issues and things like that, you'd be more than happy to help them, and you're very well educated in mental health, right?
As a PCP, primary care provider, we deal with these conditions, especially anxiety, grief. Some people have lost their family member and they also end up with depression. So we are very used to treat this kind of condition. In the Mental Health Awareness Month, there's also a line or text that you can do. In Texas, the service is actually nationwide, and we have healthcare providers that they can provide telehealth encounters. The PCP is your front line, but if you don't get access, there's also access via internet or with a phone call. Especially those people that are at risk or they have acute situation. There's a hotline for suicidal risks, so we also can reach out. The PCP is in charge of also managing psychotherapy or cognitive behavioral therapy, which is actually counseled via a psychologist. Both of them are effective trying to the mental health condition during COVID-19. So the primary care is a front line. We have also internet and other resources. But the most important thing is stay connected. How we can cope with this is staying connected. We need to reach out to others, ask for help. Also, we need to keep a schedule, a routine. Make sure you eat well, because then if you keep good habits, your brain is healthy too. Exercise your brain, exercise relaxation technique, take a deep breath, do yoga, do some gardening, practice some sport, or have plans for the future. Actually, people who have plans for the future, they seem to cope better. And with acute situations like in the COVID-19 quarantine. We
Wow.
need to have plans.
Yes, and that's funny you should say yoga, because we do have videos right now on our Facebook page with where we're doing yoga for our seniors. So if you're looking to do something like that, you can go into our Facebook page at Gonzaba Medical Group and look at those yoga videos and help you do those exercises. Is there anything else, Dr. Diaz, you would like to add?
That you are not alone in this pandemic. We are able to reach out via Facebook or reach out via FaceTime. Communicate with your family member. We are isolated, but we are not alone. So, if you have some sadness for an acute situation, or you are grieving because a family member have left us, reach out with any group, any organization. Reach out every day. Call your family member every day. We all gonna be in this together, but we're gonna do good together.
Thank you, Doctor. Dr. Melissa Martinez Diaz. You may hear me call her Dr. Martinez and Dr. Diaz, but her full name is Dr. Melissa Martinez Diaz. And thank you for letting us know this. We want everyone to know out there during this self-quarantine, you are not alone. If you're experiencing any of these symptoms, please let us know. If you're looking to join Gonzaba Medical Group, Dr. Diaz is accepting new patients. And she can answer any questions you may have. We do want you to make sure, call the number that you see right now, 780-6199. Again, that phone number is 210-780-6199. We want everyone to know, again, you're not alone during this COVID-19 crisis. And just in case you're wondering, Dr. Diaz, you do speak Spanish, right?
Sí, hablo español muy bien.
Perfecto. There you go, San Antonio. Dr. Diaz is here, Gonzaba Medical Group. She is located at our main clinic on Pleasanton Road. If you want any information on joining Dr. Diaz or Gonzaba, contact numbers 210-780-6199, and we're here to help you. I want to thank Dr. Diaz for coming out and giving all that great information on the mental health. If you have any questions and you're looking to join Dr. Diaz and you're not on an insurance plan that we don't accept here at Gonzaba Medical Group, we do have today with us Mr. Louis Garza, who is an independent insurance broker and helps a lot of people with Medicare and all their Medicare options. Is that right, Louis?
Absolutely, Stephen. There's a lot of information involved with Medicare. You can be bombarded with things in the mail, on television, so it can be confusing at times and cumbersome. So I'm here as a local agent here to make sure that you do enroll into the proper Medicare plan for yourself, because there's a lot of options available, and it is important decisions to make involving Medicare.
Yes, and as we all know, right, seniors sometimes have a difficult understanding Medicare, or what kind of plan to join and things like that. Sometimes they just join a health plan because they're told by their neighbors or something. Absolutely. So it's good that we have someone like you, Louis, that can help sit down with them and educate them. I have a question though. Right now with the COVID-19 going on and everything, you know, a lot of the patients and a lot of the seniors are afraid of that face-to-face contact. So if they are looking to enroll in a Medicare Advantage plan and things like that, how can you do the enrollment?
Great question, Stephen. Yes, thank you. So right now with the COVID-19 going on, there's a lot of caution for the seniors having that face-to-face interaction, but having to make those important decisions of enrolling into a Medicare plan online. So what we can do is all the major carriers, I'm able to guide them step by step on the process. We can do the enrollment over the phone, or if they have internet service, we're able to do it through email as well, digital signatures. So we are able to do that, and we can do it step by step. Just give us a call, and we'll be able to walk you through that whole process, so you won't have any worries in making sure that you're on the right plan.
All right. Well, thank you, Louis, so much for coming on with us here at the Connection Wednesday video with Dr. Martinez and mental health. If you have any questions, again, regarding your Medicare or joining Gonzaba Medical Group, you can contact us or Louis at 780-6199. Again, that phone number is 210-780-6199. Give us a call. We have representatives standing by. We're here to help you. We're going strong. We want you to know you're not alone in this situation with the COVID-19, and Gonzaba Medical Group is still accepting patients. Thank you again. Tune in to next Wednesday to see what we're going to have for you. It's a surprise. It may be another contest, or we may have another fun activity that we're going to do. I'm not good at activities, Louis, but we got to do it anyway. But tune in to the next Connection Wednesday at Gonzaba Medical Group on our Facebook page. Share it with your friends. And again, if you have any questions, call us at 210-780-6199. Thank you again, Louis, for coming out.
Thank you.
Thank you, everyone, and have a great day.